the type 2 actually starts long before you ever get high blood sugar, before you ever get the symptoms. So you would have no symptoms at all. Typically, a doctor would say that, oh, you're getting up 3 or 4 times a night to urinate, and you're peeing all day long, and you're thirsty all the time, and so you're drinking water like crazy and peeing and drinking and peeing, drinking and peeing. And then they go, aha, then they test the blood, the urine for sugar, and if the urine has sugar in it, aha, it's diabetes.
There we go. Okay. All right, lots of people hopping on. You know what? Today, I think we may enable some of you to hop on camera again. We're going to see how that goes. I probably won't have you on camera the whole time. Well, actually, you will be, but I'll change the view so not everyone will see it the whole time. But we're going to talk about all things type 2 again today. Welcome to the Fixed Blood Sugar webinar. It's me and Dr. Saunders today.
Hello.
We are going to talk about type 2 complications. And, you know, we bring up some of these things, but I am excited. What I want to talk about is yes, the complications, but what happens if you don't manage your diabetes well? You know, I want to talk through some of that. A lot of you know what happens, but I think it's good too. Those of you who are maybe concerned about prediabetes, or maybe you've been diagnosed with prediabetes, or maybe you just don't want to get diabetes. Why? What are the common complications of the diagnosis? And so we're going to dig into that today. If you would like to be on camera, go ahead and raise your hand. If you're on Zoom, you can do that real easily by clicking the raise hand button, and that will tell me that you want to come onto camera. Make sure you're fully dressed, please, por favor, and see what we can make happen here. So I am going to, let's see, yeah, that'll work. Give me 1 second while I do that. A lot of you are hopping on. Dr. Saunders, once again, camera. Too late. Too late, you already are. All right, and before we begin, I'm also just going to mention that Dr. Saunders is not your doctor. So please discuss any changes that you're considering making with your provider. Ooh, Butch is on today. How are you? Betty's here. Tom's here. These guys are going to hop on. Once I add you as panelists, you should be able to enable your camera. So lots of people on today. Great. Say hello in the chat if you would like to do so. Ooh, the Ungers are here. Awesome. And Jennifer is here from Houston, Texas. Judy is back from Kansas. Great. Brianne is back. Hello. Those of you on Facebook and YouTube, we're so glad you're here as well. You can comment in the comment area as well. We'll do our best to get to some of those. There should be a link for you on YouTube to click, take you to bartonwebinar.com. That's the hub for all of these things. And so you'll be able to find out more information about us and watch past webinars. There's a link to our YouTube channel, find out our top asked questions, etc. So go ahead and do that. Isaac is here. Hello from Southern Africa. We have someone from Tennessee. Awesome. Sue and Bob from Texas. Robin's here. Great. Hello and welcome, Rebecca from Indiana. This is wonderful. You are at the Fixed Blood Sugar webinar. If you're seeing, oh, look at our friend Butch. I haven't seen you in a while. It's so good to see you, which is awesome. I got to hear a little bit about his story. He was just such a fun guy. So I'm excited that you're on here, Butch. Let me see here. I'm going to see if I can enable some more of you guys. And then we'll get started with our regularly scheduled program. Okay, Catherine, you want to come on video? Awesome. And Betty, I think I already enabled you. Let's see. All right, you guys see if you can enable your cameras. If you would like to come on camera, just click that raise hand button, and I will enable that for you guys. You can come on camera. It's always fun for us to see you guys. And everyone likes to know that it's actually real people on these webinars. So Mary is here from Iowa. Dan is here from Myrtle Beach. Lloyd is back. How are you, Lloyd? Who else do we have on? Okay. Kelsey from Sacramento. We have Rand, yeah, Pennsylvania. Awesome. Okay. All right, we better get started. Ooh, John is here from South Carolina. Great. More people want on. Oh, Emil's back. Hello. Robin is back. Look at you guys. All right, let's see if it works. Okay, we're going to go ahead and get started while you guys are hopping on. So again, today we're going to be talking about the complications of type 2. And hello, Tom. And Dr. Saunders, if you could maybe start us kind of from the beginning, maybe what leads people to even think that they might have type 2?
Oh, that is a good question because the type 2 actually starts long before you ever get high blood sugar, before you ever get the symptoms. So you would have no symptoms at all. Typically, a doctor would say that, oh, you're getting up 3 or 4 times a night to urinate and you're peeing all day long and you're thirsty all the time. And so you're drinking water like crazy and peeing and drinking and peeing, drinking, peeing. And then they go, aha, then they test the blood, the urine for sugar. And if the urine has sugar in it, aha, it's diabetes. And that's typically the scenario, how it works out. However, let's go 10 years before that. What is it going to look like? Nothing, nothing. What about a couple of years later? What does it look like? Well, I get fatigued easily. People who say that they lack energy, and this is something that's been well documented in animals, in all kinds of animals. And last time I talked about hummingbirds, right? This was from a book I just read called "Nature Wants Us to Be Fat," and he talks about hummingbirds and how every single night hummingbirds get type 2 diabetes. They get insulin resistance, they get fatty liver, they get overweight, obese, they gain a bunch of fat. Why? Because they're eating sugar all day long. That's all they do. They're sucking the nectar, which is just pure sucrose, right? And they're eating sugar all day long. Oh, sugar, 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 sugar. And by the time they're done at the end of the day, they have fatty liver, they're overweight, and they have insulin resistance. And here's the other thing, it decreases their ability to make ATP. ATP is the energy system of your cell, and that's the let's say electricity of your cell. That's what gets things going and working, and nothing works if you don't have ATP. And so you diminish the ATP, and then the hummingbird can go sleep at night, and it has such a high metabolism that it burns up all that fat all night. All the fatty liver and everything gets all burned up because it has a super high metabolism. The heartbeat is like 300 beats per minute, and it's and so this high metabolism is using up all of that fat that it's stored, all the glycogen that it's stored, and then it's got to go out in the morning and go, now I'm hungry, and it goes out and eats sugar all day long, and that's what a normal hummingbird does. And bears, the same thing. Bears will eat meat for a lot of the time, and then when the berries and the fruits become ripe, they eat like crazy, all of it, and they'll eat hundreds of thousands of berries a day, and their liver will get fatty, and they'll gain a lot of weight, and then they'll decrease their energy again. The energy's lowered down. They don't make as much ATP because of this insulin resistance. They've developed type 2 diabetes, and then they go in and take a nap for 2 months, and use up all that fat during the whole time they're sleeping. They don't eat anything. They don't even drink anything. There's no food or water. Where does the water come from? Well, it actually comes from when you burn fat. There's some water in the fat, but when you burn fat, you take the hydrogen and the oxygen, and you're breathing in the oxygen, and then you take the hydrogen from the fat, and you put it together, and you make water. And so it's called metabolic water. So, and then a lot of animals that have don't use water, they can reuse their water. So the point is that before you have any other symptoms like urinating frequently or anything, you might have weight gain, and you might have a decrease in your energy supply. So people who say, gosh, I'm feeling so fatigued, I'm just like, man, like I don't have get up and go, like I don't have very much energy. Sometimes that's the beginning of type 2, and it's sometimes the first symptom you get.
Very interesting. How many of you guys can relate to that? Those of you on camera, feel free to raise your hand if you can relate to some of that. All right, I see some hands going up. Oh, look at all of you. Hi, Ginger. Hi, Beverly. Emil is back. Yay. So glad you're here. Feel free to comment in the chat too. I'm just curious if that's kind of been your story. It's good to see where everybody started, and we want to hear where you are now too. So if you want to comment about that, we'd love to hear where you are now. And if you've used the diabetes solution kit, that's primarily what we talk about on this webinar. Kind of like to get a gauge for that. Who's used that? Who's familiar with it? Okay, awesome. Yep, I know. Yep, I know you have, Butch. Yep. Okay, great. So let's talk about this now. Some of the complications. I think, if you, right, I've heard from a lot of you that when you've gone in, the doctor said, okay, we're going to put you on this medicine or this, that, whatever. Maybe not a lot of discussion about food, or maybe some discussions about food that were a little bit different than what Dr. Saunders recommends. What happens after that? So we get on these drugs. Do they typically work for most people, Dr. Saunders?
Typically, they work in one sense, and that is lowering blood sugar. So, and that's what they're supposed to do. That's what they're tested to do. That's what they're marketed to do, is to lower blood sugar. The problem is, as they lower blood sugar, they increase insulin resistance. So they actually cause more problems than they solve in the case of type 2. Because if type 2 is toxicity of sugar, and your drug is putting more sugar into those cells that are already packed full of sugar, then it causes increased toxicity, and it does more damage to your cells. So things like the complications that we're talking about today, kidney disease. Before you ever get high blood sugar, you could already have kidney disease. And the kidney function happens because there's a lack of energy in the kidneys. There's just not enough ATP in there for the kidneys to function properly, and so they don't. Yesterday I had someone in my office, and she's never had diabetes. But we tested her, and actually she came into me because she was tested and her kidney function was low. And she says, oh my gosh, I don't want to go on dialysis. What's going on here? They said I don't have diabetes, but I have low kidney function. So they hadn't tested, so I tested for insulin resistance. Remember, it's the 4 tests: insulin, C-peptide, glucose, and hemoglobin A1C. And her insulin and C-peptide were quite high, with high hemoglobin A1C. Well, the hemoglobin A1C was almost normal, was in the 5.7 range. So the insulin resistance was quite dramatic. And so I said, that's the problem right there. The problem is you have insulin resistance. And she doesn't have diabetes. Her estimated glomerular filtration rate was about 48. It should be about 60. So we put her on a program, and essentially the diabetes solution kit, right? And within it's been a little over a month, 2 months it was 2 months from December. Her estimated glomerular filtration rate is up to 59. And so that's almost normal. Normal is 60, over 60. So her kidney function improved by getting her insulin resistance down. And that's worked pretty well so far.
Awesome. That's great. A couple of people have chimed in and someone said, I was always tired. And then let me see if I can find the last one. So many messages are coming in. Guys, if you have a question, feel free to post that in the Q&A.
You know what? If you're always tired, that's a different issue. In other words, is it that you're always tired because you have insulin resistance? So why does that happen? Well, there's one reason is that I discussed, like with the bears and the hummingbirds, that you make less ATP. That's one reason for always being tired. But there's other things too. A normal person burns about 60% of their energy calories comes from fat, and about 40% from glucose, sugar. And if if you have some insulin resistance and it's mild insulin resistance, insulin tells your body don't use fat. So you actually may have less fat and more sugar. We've talked about this before. And when you have less, your baseline energy is actually low because you don't burn fat very efficiently. So that can be an issue, and that has come up. I've had several patients that have had that, where they just don't burn fat efficiently. And so the way that works, if someone, this is someone who's over 40, and so if someone can get to 40 years of age and be functional somewhat, then they're burning fat. They have to be burning fat. So what we did is we kind of did the diabetes solution kit and push her into increasing her fat use for energy because she's eating not enough calories in carbohydrates. So she has to burn fat. She's kind of forcing her body to burn fat. And that's helped a lot. So that's another thing that can work for chronic energy problems.
Okay, there was another question in here. I already lost it. Oh yeah, because we did have another person say, I only get fatigued after an unusually big meal. And that makes sense.
Oh, yeah.
Yeah. Yeah. So after a big meal, one of the things that can happen is your blood sugar goes up after a big meal. And then so you make a lot of insulin, and the insulin tells your body to take in all the sugar, and so you drop your sugar too low. So a lot of people get fatigue after a big meal because of hypoglycemia, low blood sugar.
All right, I'm going to quick read a message here from Tom. I started phase 1 on December 1st. I've lost 32 pounds and still have about 10 to go. That is awesome. My A1C in November was 6.8. At my doctor's appointment Monday, my A1C was 5.5. Yay. I have 2 questions. And actually, is Tom on here? I don't know. Okay. First, my fasting blood sugars in the past week have been 111, 110, 98, 104, 102, 107, 116. It is rarely below 100. Why aren't my fasting blood sugars lower? Second, when should I graduate to phase 2?
Okay, fasting blood sugars are not lower because you still have insulin resistance. Remember, I was just saying how people can have even complications of diabetes before they even get before they even get high blood sugar. So the blood sugar is less of the issue. The insulin resistance is the bigger part of the issue. So getting your insulin resistance down or making yourself more insulin sensitive is the answer to that. So the question of why is a good question. So what are you eating? Are you eating more carbohydrates at night or whatever? Some people are really sensitive to fat, and fat does make you insulin resistant. So, and you can be insulin resistant after eating some fat for 10 hours after eating fat. So then you, like, let's say you have dinner and then in the morning, you still have some insulin resistance because you had fat for dinner. That's a possibility. So even though your hemoglobin A1Cs, your averages are looking good and all of that, if your morning blood sugar is not between 70 and 90, you're not there yet. You're not ready to go on to phase 2. Phase 2 should happen when your blood sugars are consistently between 70 and 90 in the morning fasting.
Also, I just want to read this other part, Tom. I already read this, but it says that you started on December 1st and you've already lost 32 pounds. That is amazing. Nice work. And also, we're talking about A1C in November was 6.8, and that at his last doctor's appointment, it was 5.5. So that's pretty awesome. Nice.
That is pretty awesome. That's from going from diabetic to non-diabetic. Can we call that a cure? No, don't say that word.
Can't say that.
I know.
I mean, yeah.
Are they going to censor us again for that?
I don't know about that, but
Darn.
anyway, okay. They'll make us take that part out probably. But congratulations, that's a really big deal. We're super proud of you. Okay. Let's keep going. One of the things, okay, so when I look under like the Mayo Clinic, it says some of the complications, some complications that maybe we haven't talked about on here. Often, one of them is skin conditions. It says diabetes may raise the risk of some skin problems, including bacterial and fungal infections. Now, why would that be?
Okay, that is interesting. And the idea is likely, there's theories behind this. There's some suppression of the immune system is possible. But most of this is called intertrigo, and that's wherever skin touches skin, and there's sweat between the skin. And so it's always warm and wet in that area between the skin. And this is common, like in the armpits, the axilla, or under the breasts, where the skin is touching skin and it's always warm and wet. And then it starts growing bacteria and growing fungus, and then you end up with skin conditions. So why only in diabetes? Well, it may be that there's glucose that's available coming out in the sweat that's allowing that fungus, yeast. They just love the sugars. And so they can grow more readily, and certain bacteria also can grow more readily with sugar. So that may be part of it. Another part may be the decreased immune function, because the immune system normally takes care of that. But if you're sweating and it's warm and wet there, it's pretty easy to do that even if you don't have diabetes, but it does seem to be worse with diabetes.
Okay, I know there was well, first of all, on top of that, I guess, we hear about slow healing in people with diabetes. Is that similar because of their immune system may be suppressed, or what are, cuts and wounds and things like that? They sometimes can become infected, and I guess that's one of the more common complications of type 2. What is the reason for that?
That's a different issue. That issue is more of vascular, a decrease in blood flow. The blood vessels are diminished; they're smaller, so you don't get as much blood flow. And that's the reason why you get neuropathy, and that's the reason why you get poor healing, like in your feet, is you're just not getting enough blood there to heal those wounds. And normally when you have inflammation, infection, and all that, it's painful, and it's swollen and hot and red. Why is it hot and red? Well, it's because those blood vessels are all dilated, and you're just running a whole bunch of blood through there, and it's circulating through, putting a bunch of oxygen to repair all those tissues, to kill the bacteria, to get the immune system there. And when you have diabetes, your blood vessels are constricted, and it just doesn't happen.
Okay, so there are a list of many others, and I'm going to just read through some of these because we've talked a lot about these. Dementia, for example, we've done some webinars where
we have a whole webinar on that one.
Type 3 diabetes, basically, is what we've called it.
Yeah.
And so that's a big one. Hearing impairment. I didn't know that.
What impairment?
Hearing problems are more common with diabetes.
What did you say?
Oh, got it.
I don't know why hearing impaired with type 2. I think that may be part of the neuropathy. I suppose I didn't aware that was a specific complication.
We're going to come back to this one. A big one is eye damage. We're going to come back to that because someone has a question about that. Kidney disease. We've talked at length about that as well. Many webinars about kidney disease. Heart and blood vessel disease. We just did a webinar talking about that. But I want to focus in a little bit on nerve damage, because this is a really big one that I think is often people are really concerned about, of course. So nerve damage in limbs, and then other nerve damage where it says nerve damage in the digestive system can cause problems with nausea, vomiting, diarrhea, and constipation. Well, I never thought about nerve damage in the digestive system. Any thoughts about that?
Yeah, so the nerve damage can happen all over your body. It happens in the brain. It happens in the autonomic nervous system. So if it's the sympathetic nervous system, Then you get your blood pressure changes, and that's why people get high blood pressure. The blood vessels constrict, and then you get a lack of blood flow, and the intestines are dependent on that autonomic nervous system as well. So the nerves going to the intestines, you get just a poor intestinal function because of that. And so people think, with the neuropathy, oh, it's just in the feet. No, it's actually from the brain all the way down in both systems, in the sympathetic, parasympathetic, and the brain too, the central nervous system. So it's all affected by type 2, and a lot of that is because of blood flow. A lot of that is a decrease in blood flow. You're not getting enough energy, and you say, wait a minute, we have tons of sugar there, but there's more to energy than just sugar. You have to burn 60% fat, 40% sugar. You have to be able to burn fat. And high insulin levels say, don't use fat for energy. Stop, no fat. And then that's 60% of your energy gone. You don't have it. And so this is really important for the nerves to function and the heart to function as well. So sympathetic nervous system also works on the heart. So blood pressure, heart, temperature, intestinal issues, everything, every nerve in your body controls everything. It's really important.
So there's really no one who shouldn't be watching these webinars. I'm pretty sure. I mean, this really affects everyone, and it's you can see how easily things could progress if you're not, wanting to take care of your health. So this is really good information. And I know many of you here on camera have had great success doing this. You could probably mentor a bunch of people actually that are on here that are just getting started, which would be a fun program actually to start. I'll have to think through that a little bit, how that could work. But in the meantime, we do have a group on Facebook, Barton Webinar. It's a private group, but you can add yourself to that. That is a really good place for you guys to kind of do community, especially now that we're getting to see some people. You can see who some people are. It's just a good spot to talk if you're on Facebook. Okay, I'm going to go to some more questions. And actually, let's take Butch's question here. I have a number of eye issues over the past year, just had eye injections for vision, and any suggestions on the best vitamins for eye health?
Yes, definitely it's worth taking vitamins for eye health. But that's not the whole thing. That's only part of the picture. Remember that there's a lot more to neuropathy than just vitamins. It's getting energy to the system, and vitamins are important for getting your energy, but that's not the whole thing. You have to actually be able to get glucose, sugar, through the blood-brain barrier into the eyeball so that everything functions well. And that is slowed and diminished when you have insulin resistance. So the problem is insulin resistance. It's not technically the high blood sugar, it's really insulin resistance, although they do go together. So improving your insulin sensitivity is the best way to do it. That's what the diabetes solution kit is about. The first step in the diabetes solution kit is a detox. You're getting rid of all the excess sugar. You're not eating any. Why not? Well, because you're toxic. And if you're toxic, then that's too much. And you can get too much of anything. You can get too much water. You can get too much lead and mercury. You can get too much protein. You can get too much fat. You can get too much of anything and become toxic. I was reading the other day about selenium and how important selenium is. And this is like a really important mineral that's not found in our soils, and it's really hard to get. And so you have to supplement in order to get enough of it. And they showed in a study in Arizona how selenium, actually they used a high selenium yeast, and they called it a selenium supplement. How adding selenium decreased the cancer rate by 50%. It was dramatic. And so that's like really important. But guess what? If you take too much, it's too much, and it can cause cancer, and it can cause metabolic problems. And you don't want to get too much. It's bad for you. Selenium is quite toxic at high levels, but you have to have it, right? So that's the way everything is. So that's what sugar is too. So that's our program, is to detox from the sugar so that you could get down to a level that's like a good level, because you do need some. Remember, you have 60% fat, 40% glucose. You need some glucose. That's a part of a normal, important part of a diet too. So so for the eyeballs, it's not just taking a pill and getting more of a nutrient. It's detoxing. That would be the first thing to do.
So if you're someone who is really looking to make some changes, maybe it's in Butch's case, for those reasons, or someone who's just really getting started, they're doing phase 1, maybe they're not seeing the results that they're hoping for, is the next step to do those 4 tests?
Oh yeah, absolutely. Yeah, because if you don't know where you are, you don't know what to do, because it makes a big difference. What if you have high blood sugar, you're just not progressing anywhere, and then you measure the C-peptide and it's like 0.01, and it's like, that's not enough. What does that mean? You have high blood sugar but no insulin. That means your pancreas is not functioning. Now you have to find out why your pancreas isn't functioning, because the problem is a lack of insulin. But what if you do those same tests, your blood sugar's high and your insulin is 60? I've seen it. Then what does that mean? It means your pancreas is pumping out insulin like crazy and it's not working. You're very insulin resistant, and that's an entirely different problem and treated entirely differently just from that one test, those differences.
Okay, good information. It's good. Okay. Kevin says, I have neuropathy in my legs, primarily feet, from stenosis, pre-diagnosis. Is there more things I should keep an eye out for?
Oh yeah, absolutely. Check your kidney function, make sure your kidneys are working, and fix the problem. Take care of it, and that's what the Diabetes Solution Kit is about. Detox off of the sugar issues, the insulin resistance, get your insulin sensitivity back to normal. In part of that book, the book I was telling you about, talked about insulin resistance can also be increased with fructose. And what's really interesting is that when you have the taste of umami is that, what they call it, the savory flavor. So some people say, well, I don't like sugar. I like salt. I like savory stuff. Well, that umami flavor also causes your body to make fructose and also causes insulin resistance. Like, really, Bruce? That's not even sugar. But it can cause problems. So it's not as simple, just do this and it gets better. It's working through to find out where your issues are.
All right. This question is from Beverly. I think she's on here. Okay. I don't know why you can't send a chat. That's a bummer. Okay. As a pre-diabetic, I'm using Cinachroma and turmeric BP, but so many supplements have been recommended. How many and which should I be taking? I'm using phase 2 of the program and fasting, almost doing the 610 reset.
Okay. Then the 610 reset and fasting, that's your answer. The supplements are secondary, and you can minimize your supplements. And the reason we made Cinachroma was because it was the minimum number of things that somebody with type 2 might need, and maximizing the amounts. So I looked at so many supplements. As we're looking through them, they have like tiny amounts of like 100 different things in it. And I'm like, well, yeah, this is for diabetes, and it's got all these things that are supposed to be for diabetes, but there's not enough vitamin D in there, and there's no vitamin K in there, and there's not enough selenium in there for anyone. So it's getting enough. That's all you need is enough. You don't need more supplements. So if you were to take like the Cinachroma once a day, that's what it's made for. It's made to be a supplement to just do that once a day. And the what was the other one she was taking?
Turmeric.
Turmeric. Oh yeah. And turmeric, again, that's something that should be taken more on an intermittent basis, like 1 week on, 1 week off, or 5 days on, 2 days off, that kind of thing. If you have inflammation, if you don't have inflammation, then you don't need turmeric.
All right, awesome. Anonymous said, I was on phase 1 for a long time until I started losing my hair, and then my morning blood sugar was never below 150. I peed 5 times a night. I need help.
Uh-oh. Yeah, you do. Okay. So there might be more going on here. Sometimes hair loss would be for a different reason. You could be deficient in biotin, vitamin B7, or have some abnormal function of an enzyme. What would I do in that kind of a case? I would probably do some advanced testing. I would do something like Genova Diagnostics has a NutriVal test, and that's a test of vitamins and minerals and amino acids and fatty acids and heavy metals, CoQ10 and glutathione. It just has a lot of metabolic tests in it that give you an idea of the functioning of your metabolism, where toxicities are, where the liver function is, and are you digesting and absorbing nutrients well? All of that is contained in that test. That's the kind of test I would do, because it sounds like what you have is a little more than just a simple insulin resistance type.
Let's see. Jesus says, is there anything I can do to alleviate neuropathy pain in my leg and knee?
Oh, yeah, I hope so. Yeah, it gets better. We've had people even on this program say, yeah, it got better. So number one, make sure your insulin resistance goes down, and so that your blood sugar is normal. So if you can get your blood sugar between 70 and 90, or if you're in Canada between 4 and 5, then it's that's the first step. The second step is to help to repair the nerves by improving the circulation and decreasing inflammation. And that's why we made Nervala. Nervala is a combination. These have been tested. They work when people have those issues. If it's dealing with the issue that you have, it works really well. If that's not your issue, it's not going to work, of course. So so doing those two things, get your blood sugar under control, yeah, get your insulin sensitivity normal, and then use Nervala.
Those of you who are wondering, okay, great, get my blood sugar under control, but how? This is the diabetes solution kit that we've been talking about. Many of you have this, but this is the hard copy. You can get a quick downloadable version right away. If you go to bartonwebinar.com, there's a link to this. But this is what we're talking about. There are different phases, phase 1, 2, and 3 inside of this book. And so you'll hear people mention phases, and that's what they're talking about. But lots of good information in here. And this is what Dr. Saunders recommends to patients that come into his office as well. But you get it for a lot cheaper. So, okay, let's keep going. Robin had a comment here. Let's see, mine went down, okay, blood sugar went down to 85 2 hours after lunch one day. Most of my fasting is 105 to 120. I just cannot get it down under 100. Any thoughts?
Okay. So then there's that. What that means is there's some insulin resistance still. And sometimes in the books I've read, and I found this in my practice as well, it takes a 72-hour water fast to get things to reverse that completely. Why 72 hours? Well, as research is done, it just seems like it takes 3 days for the metabolic switch to turn on. And that switch is you have a primarily sugar burning metabolism, has to switch to a primarily fat burning metabolism. And how do you get that switch to happen? Well, if you only fast overnight, that's not enough to switch to fat burning. You still have glycogen that you can use and all that. And you have to change the enzymes. These are the actual mechanisms for making energy have to change. And it takes about 3 days for that to happen. So when people are really frustrated, like, dang, I'm doing everything right. I'm cutting out the carbs. I'm not eating more than 20 grams. I'm doing it. And it got better, but it's just not getting there to the part where I'm ready to move on. There's still some insulin resistance. That's the point at which I tell them, okay, 72 hours, water only, and that often completely resolves the problem. And the authors of the books that I've been reading about this, like the Circadian Code and those, they found the same thing. That's pretty much what it takes for some people.
Awesome. All right. Flora says, can we use magnetic plates in shower to increase blood flow in the feet? Blood has iron.
Yeah, blood has iron. Okay, so the magnetic fields may improve blood flow, and that may be how they work. I've seen this has been around for a long time. I've had people using it. I've used it in my clinic. And the magnets, of course, aren't very strong, and the magnetic plates might be okay, but it doesn't take the place of getting your blood vessels open and getting blood into your tissues. So you still need to get blood into your tissues. The temporary, the use of a magnet and whatever in the shower in different places may help for that brief period of time, but you still need to get the blood vessels working. So that's why controlling the blood sugar, getting the hemoglobin A1C down, getting your insulin improving your insulin sensitivity, and then using the alpha lipoic acid and benfotiamine, Nervala, to repair those blood vessels so that you can get good blood flow.
All right. So lots of questions about the testing. And so we've had some questions that said, what if my doctor won't give me these tests? And what if they do these tests? Are they going to know how to even correct any abnormalities?
Unfortunately, not always. Some doctors they'll look it up and they'll understand what the test is and how it functions and what it's looking at, and be able to help you with that. But some won't. And I don't know. And then how do you get the test? I don't know. If your doctor won't order it, there are ways to get tests online now. They send kits out, and you can get the blood draw, and in some states you can just walk into a lab and do your own test. Some states don't allow that, like New York and California. Anyway, so finding a way to get the test. There are online possibilities, and then getting it interpreted, and that's where we can help. That's why we do the question answer here. We've discussed specifically some people's numbers on this program and said, okay, this is how to interpret this test. And so, if your doctor can't help you, maybe we can.
All right. Hey, Flores, I can see your questions. I'm just trying to go in order between the Q&A and the webinar chat. If you can post them in the Q&A, it's a lot easier for me to manage them because the cat keeps going. Those of you who are panelists, you're going to have to post in the chat because you're not able to type Q&A questions when you're a panelist, just so you know. But I promise I can see all the questions. I just can't answer all of them right away. Sorry. Okay. Let me go to this next one. Okay, so this has come up before. What are your thoughts about drinking water with baking soda? It's supposed to control blood sugar. Does it work?
Okay, so water with baking soda, it's not for control of blood sugar, and it doesn't really do that, but it does alkalinize somewhat the kidneys and the urine and prevent damage to the kidneys to some extent. So there have been some studies done that have used that have shown that people with diabetes are less likely to go on to dialysis if they already have some kidney insufficiency and they've used the baking soda in water treatment. They don't they are less likely to progress on to dialysis. So that's pretty good, and the studies are pretty good about that. And so anyone who has renal insufficiency, I tell my patients to use a half a teaspoon of baking soda in water in the morning, first thing every morning, and it seems to have worked pretty well.
I'm going to read this. I don't know that we can comment on it because we'll probably get shut down. But Rosaria says fasting for 4 days, those also help in killing cancer cells in your body. And there's a question mark.
Oh, okay. No, there's research on that. That's actually being researched right now at USC in Southern California, and the researcher is Dr. Walter Longo, and he has shown that yes, fasting for 4 days, that's one of the things. You enter into autophagy, and autophagy takes out dead cells, cancer cells, old tissue, proteins. It clears out your brain. Yeah, it's a big deal. In fact, there was one study at USC that he did that showed that if you fast for 2 hours, for two days, 48 hours before a chemotherapy treatment, these are people who already have cancer, 40 hours before chemotherapy treatment, and then 24 hours after the treatment, then the chemotherapy worked 3 times better, and you don't get toxicity. So it was quite dramatic. Fasting is amazing for what's called autophagy, for removing bad cells, dead cells, all that stuff.
All right, and someone had just said, let's see, they commented about fasting again. Let's see, lots of are doing it, which is awesome. Someone had just said they feel so good. They've gotten it up to where they fast for 25 hours now, and they feel amazing. And then another person said, we mentioned in the diabetes solution kit intermittent fasting, but what does that mean, and what's the difference between that and the 6-10 reset?
Okay, so the 6-10 reset is sort of like an intermittent fasting. The idea of intermittent fasting is to have your stomach empty for a longer period of time than just like 12 hours overnight, so that you increase the amount of time that your stomach is empty. That's the intermittent fasting. So people who have, they look at how much time they have to eat. So if you're eating 2 meals a day and you eat just breakfast and lunch and you skip dinner, then that's intermittent fasting. And that's a really good way to go. And so how many hours? Well, a 5-hour window of eating is awesome. In fact, if you have diabetes, that 5-hour window, 2 meals, and that's it, and then have an empty stomach the rest of the day, that would work really well for improving insulin sensitivity. But it's been shown that an 8-hour window, so eating like 8 a.m. to 4 p.m., having 2 or 3 meals in an 8-hour window with a 16-hour fast every day was actually useful as well. So it's highly variable, and there's a whole book written about the 5-hour window of eating, intermittent fasting, and that works well for weight loss. And then there's 1 meal a day. The person that just said they have they're fasting 24 hours or 25 hours a day, 1 meal a day. That actually works really well. That's a great detox, and it's a great fast. So, however that looks, different people will do it different ways.
All right, Flora says, what do you use for a nerve infection?
Okay, nerve infection those are really hard. Things that get in the nerve are really hard to, like antibiotics don't usually get there. But for inflammation of the nerves, start with benfotiamine alpha lipoic acid to get the inflammation out. Your immune system has to clear it out either way. There's just no other way to fix an infection in the nerve. And it depends on where it is. If it's in the brain, that's a big deal and very hard to treat. If it's in a peripheral nerve, then it's a little easier.
Okay, so Sue and Bob are asking, would insulin or C-peptide show up in the report that you received back from a CBC panel?
No, the CBC won't show either one of those. The CBC and the Comprehensive Metabolic Panel, the CMP, is going to look at the kidney function. So you'll be able to see what your estimated glomerular filtration rate and your potassium, sodium, calcium, and then the liver function tests. If you have high liver function and that, fatty liver disease, all of that's going to show up in the normal metabolic panel. But the doctor will have to specifically ask for a C-peptide and insulin.
Okay. Anonymous says, what? So eating salt can also make insulin resistance worse?
Yeah, salt. There's some evidence for that. So having a lot of salt, and it may not be the salt, because when they do studies, it's hard to ferret these things out. And the people who were drinking, they used rats too, who had a higher salt. But then what they're not looking at is how much potassium they're getting, because if you get a lot of sodium in your diet, but you also have a lot of potassium, then you can balance that, and your kidneys can get rid of it, and it doesn't cause the changes in blood pressure that lead to the diabetes stuff. But the umami flavor is a little different. So it's not just salt. That salt may have an effect on it, but the umami taste is from glutamine or glutamate, and there's an adenosine or inosine, yeah. And so these are that full rich flavor called flavor enhancers, that glutamate, and those do cause your liver to make more fructose and increase insulin resistance. So yeah, you got to be careful of the chips all the way around. Remember I told you about that patient that she could eat bread and it was no problem, but if she had what was it, nachos, she had nachos, her blood sugar just shot up. Well, there's a lot of glutamate in that, and so there wasn't a lot of sugar, but there is some sugar in the corn. Anyway, it's just different, and that's when we go into phase 2, and then we tell you measure your sugar, see what effect it has, get a continuous glucose monitor, find out how what you're eating affects your blood glucose, and that's how you'll know.
All right. Let's see. Question here from Julie. I wanted to ask a question. Do you have to have the flush niacin, not niacinamide, I know, necessary to take for the better cardiovascular health?
Okay, that's a good question. And the answer is not really clear, but it seems like yes, you need the flush niacin, you need niacin to improve your HDL, high density lipoprotein, that's the cholesterol. As to whether that actually prevents heart disease, that's where the question is. It doesn't seem to, and it depends on the study you're looking at, but it's not clear. Niacinamide doesn't affect the cholesterol as much. So yes, you're correct on that. But it may not be as important as people said. In other words, it does raise the HDL somewhat, but as to whether it affects heart disease is still unknown.
Okay, Patricia said, what should I eat when I wake up to a blood sugar of 49 and it's hours till breaking my fast?
My next question would be, how do you feel? Because you know what? If your blood sugar is 49 and you're still fasting, you could just go with it. Don't do anything. You don't have to do anything. I told you the story about the study that was done on the rats where they kept their blood sugars in the 40s. And after 3 days, the rats were like normal rats and their blood sugars 40. And they were doing great because they got so insulin sensitive because their blood sugars were low consistently. And so having a low blood sugar is actually not a problem, and it's good for increasing insulin sensitivity. And so when we have the diabetes solution kit and we say, eat less than, which could be 20 grams of carbohydrates a day, it's possible you could get hypoglycemia from that. Is that a problem? No, it's not a problem. It's actually a good thing.
We have one of the side effects from mayo, not side effects, complications from mayo does say hypoglycemia can happen if you have type 2.
Yeah.
I think that's probably with meds and all of that kind of thing. But also you're talking to the person, Dr. Saunders, who was up on stage fasting and passed out. So
in front of 150 people.
yeah, keep that in mind. But it is interesting. And I think too, hypoglycemia can feel very scary when it's happening too. So okay, let me see here. Okay, Javier says, I'm pre-diabetic. Should I be measuring my sugar levels with the pinprick and monitoring device? Is that only if I were to progress to 2 or 1? Type 2.
Type 2 or type 1, yeah. If your blood sugar is elevated, it's helpful to know. And we recommend just doing it at least once a day, like just in the morning, to see what your fasting blood sugar is, because if it's high, it's an indication of insulin resistance. It's not about the sugar. The sugars, we're using it as a means of determining how much how much insulin resistance you have. So it's a good idea to test, and if you could get a continuous glucose monitor, that would be even better.
All right, we're running out of time. Oh, let's see if we can do another one. All right, let's see. Maria said, I tried to do a 3-day fast this weekend. After 62 hours, I got a severe headache, and I broke my fast to try and deal with it. After that, the headache eased, and I could sleep.
Okay, you know what? That's perfectly fine. You did a good job, and you did a good thing. And you got hypoglycemia, low blood sugar, and you got a headache from it, and that's okay. And then you ate, and the headache went away, and you went to sleep. I think you handled it well, and I think that's great, and it's perfectly okay. I'd be really interested though that when you got a headache, if you had measured your blood sugar, I wonder what it was, because it's probably hypoglycemia.
Yeah, Rayanne said, try drinking a little water with salt. Okay, final question. Okay, this is from a Zoom user. I am now 96 pounds with no body mass or muscle mass. I'm down to just skin and bone. I eat great and lots of all foods all day long, no sugar. I have a hard time getting the proper testing done. I'm in Ontario, Canada. The virtual doctors just say we're going to do only the test we do in our city.
Oh my goodness. Huh. So if that's the case, and you're it's called adult failure to thrive. So if you identify yourself, instead of as a diabetic, if you identify yourself as adult failure to thrive, then they would be able to do different testing. Because failure to thrive, you have to look for the cause of that, because that means that you're losing weight and you're not able to gain it back, and you're getting to the point of you don't have enough fat mass to maintain your temperature and your metabolism, and it gets dangerous, and then women will stop menstruating, and this is not a healthy thing to be that low. So sometimes using a different diagnosis will help the doctors to be able to do testing to find out. But boy, and you may have to go to like a tertiary care center in Canada. Go to like a hospital that's a teaching hospital, because they will often do further testing to find the underlying cause.
Right. Okay, thank you, Dr. Saunders. We appreciate you. We'll see you tomorrow on the Healthy Heart webinar.
Hasta mañana.
Thank you guys for joining us today. If you want to join us for the Healthy Heart webinar tomorrow, it's at 12 noon Central Time. You can register at bartonwebinar.com. That'll be another good one with Dr. Saunders. And it's good to see all of you. See you next week or tomorrow. Thanks for hopping on. Bye-bye.